What can a caregiver look for in their client's breathing? Let's find out today on JoJo, the Caregiver Show. Now, I think we all take breathing for granted, but if you remember Abraham Maslow's hierarchy of human needs, he had breathing as the number one physical need human beings need in order to survive. This is actually because without breathing, we would actually die in 4 to 6 minutes. So breathing is something you should be paying particular attention to your clients. It can be a very serious indicator of your client's illnesses, or it could be heart disease. It could tell you your clients have an infection. It could actually tell you your client is in extreme pain as well. So the first thing I think we want to check with our clients' breathing is how often are they breathing in and out in a 60-second time frame. Now we call this their respiratory rate. When your client breathes in oxygen, we call that inhalation. When they breathe out carbon dioxide, we call that exhalation. So the act of inhalation and exhalation is what a respiration is. When you count that, how many times your client is doing that in a 60-second time frame, that's going to give you your client's respiratory rate. Now, the average adult will breathe in and out 12 to 20 times per minute. So if your client is higher than 20 breaths per minute, could be something like hyperventilation or rapid breathing, what we call tachypedia. And then the opposite, if it's less than 12 breaths per minute, that could be hypoventilation or slow breathing, what we might call bradypedia. So as a PSW, you first want to discover how many times per minute your client is breathing in and out. Now, how you do that is you would watch your client's chest rise and fall over those 60 seconds. When they breathe in, the chest will rise up. When they breathe out, the chest will fall down. That would be one respiration. So you're going to count that movement over 60 seconds to get your respiratory rate. Report that to the nurse. The other important thing is you should not tell your client you're taking their respiratory rate, because your client will actually start to breathe differently if you tell them that. So try to do it while you're doing something else for your client and kind of watch their chest rise and fall over a 60-second time frame. Now, other things that you can keep in mind to help your client with their breathing is you can actually do breathing exercises with your clients. So how you would do that is you would tell your client to put their hands on their abdomen and tell them to breathe in deeply through their nose. Take as much breath in as they possibly can through their nose. You're trying to get that lung expansion. And then tell them to hold their breath for 3 seconds. This will actually help your lungs with not only their expansion, but also the pressure in the lungs, and getting them to hold it for that period of time is actually like exercise for their lungs. Now, when they breathe out, tell them to breathe out through their mouth, and their mouth should be slightly closed, something that we call pursed lips. So they're going to breathe in deeply through their nose, hold for 3 seconds, and then breathe out through pursed lips. You should do that 3 or 4 times with your client on a daily basis. This should help your client breathing capacity, helping them take in more oxygen, which of course is important for many of the body systems, including your client's cognitive ability. If you can get more oxygen in their blood, more oxygen to the brain, this is going to be quite helpful in your client's daily activities. So try out that exercise with your client. Other things to keep in mind, like make sure you're not the reason they're having breathing difficulties, cologne, perfume. Do they have any allergies? You also should be looking out for things like, is your client making noises when they breathe? So like wheezing, groaning, gurgling might indicate water on the lungs. Your client is supposed to actually be breathing quietly, effortlessly, and regularly. So are you notice anything out of the ordinary between those 3 factors? So labored breathing might be one, difficulty breathing might be one, different types of irregular breathing your client might have. those types of things could actually help you discover your client is having some major health problems. Like you might discover they have an infection. It could also be something serious like heart disease, could be something like anxiety or even a panic attack. You guys could really be the people that discover these types of things for the healthcare team, and then you're going to be getting your client the help they need in an efficient time frame. So keep that in mind the next time you're walking in on your client. Always observe and report on any breathing difficulties that you see, and pass that on to the healthcare team immediately. Remember to like, share, subscribe, and I'll see you next time on JoJo the Caregiving Show.